The Health Department expressed support for the bill aiming to provide benefits to all healthcare workers with or without direct exposure to COVID-19 patients. From the current 300,000 frontliners eligible for benefits, over 500,000 medical workers are now eyed to receive allowances. However, the DOH is aiming to provide these allowances in a single payout.
It, however, proposes that a singular allowance will be by the bills. It, however, proposes that a singular allowance will be offered which will cover and substitute for all the benefits enumerated in the bills. In addition, the rate of the allowance would vary according to the risk exposure of the healthcare worker in particular work settings.
This means all allowances for risk, hazard, meal, transportation, and insurance will be received one time, big time. Health workers will receive different amounts depending on their levels of risk exposure. Under DOH guidelines, health workers with low risk exposure will receive 3,000 pesos, medium risk will get 6,000 pesos, while those with high risk exposure will receive 9,000 pesos. Those classified as low risk are health workers in offices within hospitals. Medium risk means workers assisting non-COVID patients in COVID-19 facilities, while those at high risk directly assist COVID-19 patients. Despite the wider coverage for payouts, health workers from the government, private, and LGU hospitals are dismayed over the proposed singular allowance. For them, a one-time payout is an insult to their hard work.
We view the DOH proposal, the singular allowance, as a divisive and unjust cost-cutting measure that reflects little regard to the selfless work and sacrifice exerted by our health workers. Ito rin po, sa tingin natin, ay isang mahigpit na paglabag sa ating existing labor law, which says that there's no diminution in benefit of employees.
Imbis na gampanan ni Secretary Duque at ang kagawaran ng kalusugan na pangunahan ng pagsisigurado sa kaligtasan, proteksyon at kagalingan ng mga health workers,
tinatawag na mga bagong bayani na pinangbabala lamang sa kanyon. Hanggang sa ngayon, nung una na bayanihan, kagaya nga po ng paulit-ulit ko sinasabi, kami doon ay iniwan, sa bayanihan 2 kami ay niloko, sa bayanihan 3 wala na namang nilaang budget para sa mga healthcare workers.
Health workers tell the government to focus on providing benefits to those who have yet to receive them instead of planning new ways of distribution.
Kami nga po sa Metropolitan General Hospital ay wala pang natatanggap na SRA at MAT hanggang sa ngayon. Kami po ay naghihintay sa kanilang tugon, bagamat kami po ay nag-follow up at sabi maghintay kami sa October.
Workers also blamed Health Secretary Francisco Duque for not including the 50 billion peso budget in healthcare workers' benefits in the proposed 2022 national budget. They also reiterated their call for Duque's resignation. Arlen Kalumbiran, We Are One News.